Sometimes a presence is so steady you may not notice it changing. For over 65 years, we've been constantly innovating. And in partnering with Ochsner, we continue to offer the most advanced technology with minimally invasive techniques for general surgery and for specialties from orthopedics to neurosurgery. Many have noticed, earning us the most accolades on the North Shore for quality, safety, and patient experience. St. Tammany Parish Hospital in Ochsner, shaping the future of health.
Hello, and welcome to a special edition of Healthy Living. We're talking today about COVID-19, the novel coronavirus that's in our community. I'm Melissa Hodgson, host of Healthy Living, and I work with St. Tammany Health System, sponsor of the program, with our local parish government. We're talking today with St. Tammany Health System's leading infectious disease specialist, Dr. Michael Hill. Dr. Hill, thank you so much for being here.
Thank you for asking me to be here, Melissa.
I know you're a busy person, but we want to keep the public informed, and so I appreciate your time. I thought if we could start very simply, of course, our parish government is working with state and federal officials, and they are working to see to it that the public understands this is a state of emergency. There are steps that need to be taken. So we, as healthcare professionals, can you talk about what the public can expect to hear in terms of social isolation, wash your hands? Talk a little bit about those major messages.
Sure. So right now, we're recommending, and this is coming from the CDC and our state government, the Office of Public Health, that people really practice social distancing now. And what that means is for the majority of people to limit access to public crowds, and the CDC has just put out a recommendation that 50 people or more are discouraged, crowds of 50 people or more are discouraged, and actually I think that number will actually drop as time goes on. And we really want everyone to practice social distancing, wash their hands well, practice good cough etiquette, not coughing into the open air or into your hands, but into your elbow if you have to cough or sneeze. And really limiting anyone's going to large group events. I know most things have been canceled, but it's important to avoid areas that might have a lot of people because we know that this virus sometimes can be spread through asymptomatic contact, somebody you're not even known to have the virus. The other thing I would say is that this is a major inconvenience for everybody, and we understand that, but we want to be safe. And it's not just about you, but it's your loved ones and the potential to give the virus to somebody who may be more susceptible.
And I think that's important too. Can you maybe explain to the public who is at risk for COVID-19?
Okay. Well, first of all, as far as catching the virus, we're all at risk for catching the virus. So that's why we're going to practice social isolation. Who is at risk for getting severe disease? I think we need to put that into perspective. The patients who are at risk for getting severe disease are the ones who have underlying comorbid conditions like COPD, diabetes, etc. Okay. And I think it's important that those patients who are in those categories, as well as those receiving chemotherapy or on immunosuppressants, really do heed the risk. We know that the overall, most patients, 80 to 85% of patients that get COVID-19 are going to have upper respiratory tract infections, fever, chills, much like you would get from the flu.
Okay.
About 15 to 20% of patients are going to have more severe illness that would require a visit to the doctor's office or even to the hospital. About 1/5 of those patients could develop severe disease requiring hospitalization and even ICU treatment. So we're talking about a small percentage of patients, but we know that the patients who have the most severe symptoms are those that are immunosuppressed, the elderly, and the elderly is defined of people 60 and older, so that includes me. But we've got to be careful that we understand that they're healthy elderly and elderly with comorbid conditions. And so again, it depends upon the person. As people age into the over 70, that's when you start seeing the upswing significantly increase. And so it really is important for our elderly population, our older population, really to practice self-isolation away from public facilities. Have somebody go get their groceries, have somebody go and get the needs that they need if we can. And if you do have to go, those folks have to go to the grocery store, have to make an outing, make sure that they wash their hands well, sanitize, at least with a 60 to 70% alcohol-based sanitizer before they, when they go into a facility and when they leave a place.
Very good. And so if I'm hearing you correctly, the overwhelming majority of us humans on this earth are going to be fine if we contract COVID-19, this new coronavirus.
That's correct.
It's that there are people in our society, in our own homes, in our community, who are at higher risk of having that virus do them damage.
Right.
And so, as you said, elderly, possibly with immune suppressed situations like heart disease, lung disease,
right.
Maybe diabetes.
Right, and patients receiving biologics, patients receiving chemotherapy.
Okay.
We have a lot of patients with autoimmune diseases, inflammatory bowel disease that may be on a biologic. At this time, we don't know what the risk factors are with some of these agents. Right. So we're saying just be careful.
That's why we're saying to everyone, healthy, you know what, even if you would be fine, don't put yourself out there because someone you love and care about who maybe does have one of these diseases or situations could be at elevated risk.
Correct.
So every one of us, we want to wash our hands. So how about we run through exactly what we mean by wash your hands?
So washing your hands is at least 20 seconds of vigorous hand washing. And actually, 20 seconds is the minimum. We really talk about trying to get up to 40 seconds. And so we do a little drill of singing the happy birthday song to yourself while you're washing your hands. And usually when you finish that song, you know that you've probably had enough time of hand washing. And really and truly, hand washing is the best way to prevent spread of infection, of any type of infection at any time. Good hand hygiene is paramount. It's better than hand sanitizer.
Well, that was the other thing. I'm glad you said that because I know there's just this run on hand sanitizer and people need to remember water and soap is actually better.
Right. So the only time we want to use hand sanitizers is when we don't have access to soap and water. Don't pass up the soap and water for the hand sanitizer if you can get to the sink and do soap and water. The couple of other things I would remind people is after they wash their hands with a paper towel, if you're in a bathroom, to open the door with the paper towel.
Very good.
And then when you leave, throw the paper towel away because you can contaminate yourself on the door handle of the bathroom.
After I just did all of that 20 seconds of happy birthday with my hot water and soap, I'm going to turn around and reinfect myself on the door.
Right. That's
so,
correct.
okay, paper towels, our next best friend.
That's right.
And I think that brings up an interesting point because you're right. Washing your hands is our single biggest lesson that we want everyone to learn, but we're also saying be very careful about your coughs and sneezes. Mm-hmm. We're saying maybe cough or sneeze into your elbow or a tissue that you can throw away,
right.
And to be sure that you're not sharing those droplets because that is the way this disease spreads.
That's right. And we're also asking you not to touch your face because you get secretions around your nose and your mouth. Touching your face then transfers that to your hand. So it's very important to use cough etiquette. If you cough into a tissue on your hand, you need to immediately hand wash after you throw that tissue away.
Very good. And so that's wash your hands and watch the coughs and sneezes and where they're going. And then a third thing is stay home if you don't feel well.
That's right. So who needs to go to the doctor? Most people won't need to go to the doctor. If you have mild symptoms, respiratory symptoms, low-grade fever, sort of like you have a bad cold or a mild case of the flu, you don't need to go to the doctor necessarily. Now, if you have any of the underlying conditions we've talked about, it may be important to call your physician or to do a video visit with your physician, but we're really trying to discourage people, unless they're really ill, of going into the office or the emergency room, and really for a couple of reasons. Number one, you don't want to overwhelm the office or the emergency room. They're there to take care of the sicker patients. However, don't discourage people if they're in the high-risk category of making a video visit or making a phone call to the doctor to ask for advice. I think that's important. But for the majority of us out there, we probably can stay home and just have some chicken soup and time. There is no outpatient treatment for COVID-19 right now other than symptomatic treatment and good nutrition and good hydration.
So Dr. Hill, for someone like me, and for anyone in my family, we're all middle-aged to teenage. We are healthy human beings, and we haven't been in any of the countries that were of concern. And so if we begin to feel symptoms, if we had a run-of-the-mill virus, if we had flu, what we would do is go home and go to bed, maybe have some Theraflu, a bunch of orange juice, like you said, chicken soup. And so truthfully, that's what we need to do now too.
Right.
And it's only if we start to see what the CDC terms severe conditions that we would want to reach out and maybe call a 24-hour nurse line, a video visit with a primary care that we already have established, and again, to not panic, hop in the car and go straight for an emergency department, because that's not helpful.
That's correct. So I think if you're a healthy person without risk factors and you have the symptoms like you described, most of the time just watchful waiting and staying at home. The signs and symptoms you want to look for that would escalate this would be respiratory difficulty, increased respirations, feeling like you can't catch your breath, high fevers. Those type of things would be something that you're going to want to seek medical advice for. Only for the subset of the compromised patients would I say, if you have true fever, and we're defining fever under 65 of over 100.4. If you're 65 and older, it's 99.6. Then you should think about at least video chatting or texting with your physician or healthcare provider and letting them know what's going on. For those people that are on biologics or are on medications, don't stop your medications until you speak with your physician. So I don't want them to think that I'm giving them advice to stop any medication. That should always be done under the supervision of a physician.
Very good. Well, thank you for that advice. So what I'm hearing is the overwhelming majority of us need to just stay calm, wash our hands, contain our coughs, and stay home if we don't feel well.
That's correct.
And then folks who are maybe at elevated risk, such as elderly or who have certain chronic diseases, should be in contact with their established physicians, and probably through video visit or phone. And then for folks who may not have that history but see conditions worsen, that would be a point at which to reach out to a nurse call line, an established primary care provider across a video visit or a phone call, and then to seek care as instructed.
Yes, that's correct.
Very good. And then let's talk a little bit then about the hospital, because I think we're hearing all kinds of rumors and stories about tents going up and things like that. With the emergency declarations, the Louisiana Department of Health had some expectations for all hospitals. So talk a little bit about what's going on at St. Tammany Health System at the front door.
Sure. And this is, as you said, not just St. Tammany, this is all of the hospitals in Louisiana.
Absolutely.
And we're limiting visits to only essential personnel, and that's one visitor per patient. We're also saying that if we have any patients under investigation, we're really discouraging any visitation at all. The Office of Public Health is saying if we have a positive COVID patient in the hospital, that patient can do FaceTime or Skype or something else, but they should not have any visitors in the room. And we want to say that that is not just for St. Tammany, that is statewide. We have a very robust screening going on at the hospital now. We have one entrance for visitors to come in. You're going to be asked why you're coming in, what's the nature of your visit. You'll have to get a visitation pass and log in. And again, we're only allowing one visitor per patient. Deliveries to the hospital, such as food or flowers, really are discouraged right now. As a matter of fact, they're not allowed. They're stopped at the front door. So we really want to say at this time, we want to very much limit who comes into the hospital.
Well, brilliant. So what I hear then is from the Louisiana Department of Health, every hospital in the state recognizes that they've got to reduce the number of people who are coming in and out of the hospital, and that only those people who need hospitalization, who are healthcare workers, or who are essential visitors to a patient should be coming.
That's correct. And the subset of patients who are suspected to having COVID-19, we're asking no visitors come in.
No visitors?
For those patients. And I understand that can be a hardship, but it really is very difficult to contain the virus if you have people going in and out of the room, and you also have other people to care for. So it puts a strain on containment, and it also puts a strain on the healthcare facility if you have more visitors.
Very good. Well, and I think that brings up a point that we should address, because there are a lot of concerns and rumors floating around about how hospitals are responding. And I think St. Tammany Health System has some wonderful protocols in place, and other hospitals follow these same kinds of protocols for isolation, for negative pressure, for what we call PPE, which is personal protective equipment, and that is every healthcare worker wears their PPE to make sure that they are protected. So can you talk a little bit about what we are doing to ensure that a patient who may turn out to have COVID-19 is handled from the get-go so that we can contain that virus?
It's a great question. So first of all, we put a surgical mask on that patient. Anybody with respiratory signs and symptoms coming into the hospital is getting a surgical mask.
And that's from outside before they ever cross the threshold?
That's even before they come into the hospital. There's a screening that goes on in the parking lot, basically, of the emergency room, or outside the room itself before you come into the doors of the emergency room. Also, if EMS is bringing, emergency medical services is bringing a patient by ambulance, or one of our fire district EMS, they are isolating those patients in the field with a surgical mask.
Fantastic. And so from that point forward, they come in, and every step of the process in our facility is following those infection prevention protocols, the protective equipment protocols, the negative pressure in the spaces, and the isolation, which is the single most important thing we can be doing.
That's correct. And we are making sure that that is followed without variation for every one of these patients to protect our community and our healthcare workers.
Very good. And I know that there are more directions coming from the CDC, from the Louisiana Department of Health, and we are responding to those things as they come. For example, you said just today the CDC is announcing that they want to see those thresholds for crowds move down to about 50, and you would certainly anticipate that they may even tamp that down further. As we see the Louisiana Department of Health providing suggestions about who an essential visitor is and how our facilities can see patients. In the clinics, for example, if you need to go to your doctor's office, we're asking that you come alone.
Yes, and we're also asking if you have respiratory symptoms to wait in your car instead of coming into the waiting area, and then we'll provide you with a mask and try to get those patients directly back into a room to prevent contamination of the waiting area and our staff.
Good. And I think we can certainly say technology is our friend in this situation, because we do have the ability to do video visits where someone may be able to start their care with their care provider through a video visit in MyChart. And then, if we need them to come in, we can take it from there.
I really think that is key. I think either a phone call, if you just have to ask a question, or if you need a full visit with the physician to ask advice, the video visit really is the way to go. And we really are asking the community to think about video visits first before going to the clinic.
Fantastic. So we're washing our hands, we're keeping our coughs to ourselves, we're staying home when we don't feel well. If our conditions worsen, we're going to try calling a nurse on call line or calling our primary care physician's office.
Right.
If it's warranted, we may want to do a video visit. And then beyond that, if we need to come in, that's going to be something that we've been instructed to go to the physician's office, or possibly if conditions are really severe, to go to the emergency department. And upon arrival at the physician's clinic, we probably want to call and say, I'm here, and let somebody come bring us a mask, and then we'll get a text when it's time to hop out of the car and come on in.
That's exactly right. And we would like to do that in the ER as well. But if you come up to the tent, you're going to be screened outside the ER, and you will be asked to put a mask on.
Very good. And people shouldn't be approaching the ER casually. If you are having severe symptoms, you need to come for assistance. But right now, in particular, and really anytime, we need to recognize that there are other ways to take care of ourselves than going straight to an emergency department.
Right. If we have too many people who I call are just moderately sick, and when you're sick, right? You want attention. But if we go to the emergency room for non-emergency needs, we could overwhelm any emergency room. And you don't want to do that. You want to save that staff and that facility for the truly, really, really sick.
And we know that that's true under completely normal circumstances. And so we know it's even more true right now while we're trying to stop the spread of a novel coronavirus, COVID-19.
That's correct. The emergency room is not a clinic, and it should not be used as a clinic.
Very good. Well, Dr. Hill, thank you so much for all of this information. This has been enlightening, and hopefully we're helping our community to understand how we can all keep ourselves healthy, keep ourselves safe, and eradicate this disease from St. Tammany Parish.
Thanks, Melissa.
Thanks for coming in. This has been a special edition of Healthy Living. We've been focused on COVID-19, the new coronavirus in our community. Our guest today was the leading infection prevention specialist of St. Tammany Health System, Dr. Michael Hill.